Here's a mental illness no one takes seriously. It's called sexual paraphilias, and it's a mental illness that encompasses a lot of things, but the core thing is that the sexual interaction is initiated regardless of the recipient's response. So it's inappropriate sexual interactions between two people, but it's only instigated by one person, but they perceive it as being appropriate, or they consider it being appropriate or something. I don't know. As in, they cannot be sexually aroused otherwise without the use of these things outside of a consensual sexual relationship. Yeah, I saw something really gross online. And I was like, oh, why did I look at that? Gross. But, so, one of the more commonly known ones, is stigmatized really heavily, people are discriminated against for it, is pedophilia. And it is a mental illness. So this is when an adult is sexually attracted to a person under the age of sexual maturity. That's what people mean by underage. When they say it's underage, it means this person is not mature enough to make consenting decisions regarding the subject matter. So, child bride marriages, child brides. I think that's been reported to be a really problematic thing, with especially regarding women's rights and everything, different parts of the world. Child brides being they are forced into marriage with men, typically underage girls, not underage women. So the point where you're capable of understanding sexual relationships and marriage and all that kind of stuff. It's you are physically and mentally capable of being involved with somebody in that context without it affecting you negatively or being taken advantage of. If that makes sense. If a really simple example would be if a 16-year-old girl is forced into marriage with somebody who's 25, right, or 26, 28, maybe 35. There's a 17-year-old girl married to a 30-year-old man. That's called pedophilia, or in lack of a better term, forced child marriages. It's a problem in society. Another one is called voyeurism. So voyeurism is sexual arousal by stalking and witnessing somebody a couple who are engaging in sexual activity, but they are aroused by watching two people be involved in sexual activity. But this is without the couple's consent. So that person breaks into your house, puts a bunch of secret cams everywhere, or is watching from your window somehow or something like that. That's voyeurism. Kind of. It's also considered voyeurism if you're addicted to pornographic material and you like watching porn and you are always sexually attracted to watching two people have sex with each other or whatever it is, and being sexually aroused by that only. That's why is it called sexual paraphilia? It interferes with that person's ability to have sex in a normal context. So if that person is consenting, that person cannot have sex with that person anymore. Voyeurism, I think, is when you inappropriately touch another person with their genitals. There's also indecent exposure, so that person likes to expose your privacy to unconsenting and unwilling partners in order to achieve sexual arousal. I don't think molestation or rape is considered sexual paraphilia, unfortunately. That's more of a criminal thing. So the reason why it's called a mental illness and mental disorder is that person who suffers from that mental illness cannot have sex with people. That's why. Unless it's in that situation. That's the reason why it's called. But a lot of people don't take it seriously. Like people think they're creepy or there's something wrong with them or like they're gonna like no. Yeah, oh, there's something wrong with that person, or like the guy's just a huge creep, or like, oh, like she's like retarded or something, like socially retarded or something like that. Those are usually like people who, how they label people or describe people who suffer from sexual paraphilias. Yes, you're supposed to be in treatment, and yeah, you're supposed to take medication, and yeah, there is treatment for it. If there wasn't, it would have been considered a medical diagnosis. Likewise, this is something people talk about a lot. I learned it in school just briefly, along with eating disorders, which is so if somebody has, I think it was multiple personality disorder, this when somebody cannot like I'm not talking about like the people with multiple personality disorders, they don't remember being that different person, but they refer to that different person as they are aware of their multiple personalities and the expression of such personalities. I don't know how else to describe it. There's not a lot of really little research done on multiple personalities. On top of which, like, there's only even case studies of them, and it's all expressed differently. But they're all multiple. Like, the only commonality is that that person has more than one personality shown at a time, and it doesn't occur due to their own will. It actually occurs like depending on, I don't know what triggers it, but they switch personalities quite frequently, and each personality has their own persona or like their own name. And this isn't like figurative like online personality name kind of thing. It's not like a play pretend, it's not like role playing or anything like that, or like when you play a character in a video game or something like that, or like when you're playing around with when kids are playing around with their friends or something, or when you're doing like, I don't know, oh, Dungeons and Dragons. There you go. That's actually a good example of like pretending to be somebody else, right? But this isn't pretending to be somebody else to scam somebody or make them believe somebody that you're not, which is a crime, and it's commonly seen online where people are presenting themselves differently in order to get people to believe that's who they really are, which is called catfishing, I think, if it's done online, and identity theft if it's done in person. It's illegal either way. Another thing is that there's not much to study from, because all of these personalities have nothing in common from case to case. And I don't remember what the treatment was. I don't think it was a really beginner course on these kind of. Only thing it really did is outline and name each single disorder. And the professor presented examples of each disorder. And also, if you have body dysmorphia, it's also a mental illness. It actually is very comorbid with eating disorders, which is also difficult to treat. Like I said, an eating disorder interferes with your life to the point where you can't actually function properly. So, the problem is, I think, with an eating disorder, like, a lot of people think that it's normal. That's the thing with eating disorders. Like, it's fine that I eat only, like, one meal a day, even though I can't afford to eat more than that. It's fine if I end up spending my entire paycheck on food every month. But the only thing that's in common is that it actually does damage their health, and it causes so much shame and guilt within that person to the point where they don't ever eat in front of another person. So when a person has an eating disorder, they never actually, like, they try to hide how much they eat, or they hide when they eat. Or in the case with anorexia, they don't actually eat. They do a lot of work to make it look like they're actually eating when they're not actually eating. And with anorexia, the person's like self-esteem and self-worth is intrinsically tied to their body weight. Same thing with some bulimias. It's called anorexia nervosa and bulimia, I think, and the other one was like binge eating disorder. There's a bunch of them, but like with binge eating disorder is like when you're eating like 5 persons worth of meals like 3 times a day. That's called binge eating for over 6 months, I think. Was it 6 months? I think it's 6 months. For over 6 months, you're eating like this. Anorexia, you can easily spot them out. They're incredibly underweight and they refuse to eat. I'm not really sure why that is, but that's anorexia. I mean, that's anorexia. Oh, with body dysmorphia, when a person sees themselves in the reflection, they are no longer looking at what they look like, right? They either see themselves too fat, or like in the case of anorexia, a lot of anorexic patients is that when they look at their body, like when they look at the self-reflection in the mirror, for whatever reason, their brain doesn't signal it back properly. So, when you look at that person, what actually ends up happening is that, their brain, for whatever reason, perceives themselves to be of a different shape than they actually are. I don't know why that is. And also another thing is that, with body dysmorphia, there are a lot of steroid users who have body dysmorphia. So typically with men who are weightlifting and they want to, achieve a bigger body, right? They end up getting on steroids and using excessive steroid use because for whatever reason they don't see themselves as like they don't actually see their muscles develop, or they don't think their muscles are developed enough, and it's again tied into their self-esteem. So when they consider what they consider themselves to be valuable is when they look a certain way. But I don't know how people cure it. It's hard actually. A lot of people may think the problem is that they're not eating enough, and yeah, they're right. The problem is it's unforceable to eat. With anorexics, like you can't actually sit there and shove food down their throat. Right? So like they're forced to eat a certain amount of calories a day in order to gain weight enough, right? But then they refuse to eat. So you'll have all that food in front of them and they just won't eat. Or they'll pick up the food, they'll distract you enough for you to think that they're eating. And then next thing you know, like all of it's gone in the trash. Because none of them were eating. Weird, right? But yeah. So, it's an eating disorder. Seriously difficult to treat. I didn't. It's not a mood disorder. It's affecting a different part of the brain. That's why. I don't think there's a medical condition. Well, there is. Actually, if you're an alcoholic, again, eating disorders are comorbid with other disorders. So don't be surprised if somebody you know who suffers from like I don't know, a personality disorder, mood disorder, anxiety disorder, such as like obsessive compulsive disorder or whatever. That kind of person actually also has an eating disorder or some sort of sexual paraphilia or something like that. Like any of that can be found within each other or something combined with each other. But don't worry, because you have more than one illness doesn't make it any less treatable or any harder to treat, because trust me, your psychiatrist have seen cases and heard about cases and seen a bunch of people, okay? Just like that. They know what to do, which is why they're doctors. If they didn't, they would lose their medical degree. But yeah. You can tell because typically people with eating disorders, I'm trying to make it quick, they stop eating and they feel nauseated every time they have to eat. They legitimately feel sick to their stomach. I almost developed an eating disorder. I had body dysmorphia at one point, but I was actually just trying to analyze the corresponding nerve signals and hoping that there's nothing wrong with my brain. No damages. But yeah. I think the whole thing is like people don't take sexual paraphilia seriously at all. Especially with like porn where they actually like sexualize that kind of stuff and they think it's kind of like hot or sexy or normal or something. And if you ever try to talk to somebody who doesn't know a thing about like psychology or like these mental disorders or something, they wouldn't know what to say or what to tell you, right? They don't know what that is, and even if they hear about it, they've only probably read like serious criminal stuff involved with it, so they're like really surprised and shocked and like they get really weirded out and stuff like that, which is normal when you encounter stuff like that if you don't know anything about it. But I say that it's important, okay? Well, homosexuality used to be considered a mental disorder. I think it's a bad sign that they took it out. It means the treatment wasn't successful or there's no treatment for it, so it's no longer qualified to be a medical condition. It's a bad sign if there's something used to be considered a disorder is no longer considered a disorder. Sometimes that's the only reason they update the DSM, because with current research there hasn't been significant progress in the treatment, or the treatment every patient and every case that they've seen has considered them to be relapsed or going against a treatment or something like that. They can no longer be legally liable for the person if anything goes wrong. So that's why they take it out of the DSM. It's like, and sometimes they update it because it used to be considered as a different condition, but they know more about the condition now. It's named a different condition. These are the symptoms to look for, not these ones. So that's like a little better, I think. Some of the disorders became like that. Some of them they got taken out because they're no longer treatable. But yeah, oh, also, which encompasses sexual paraphilia, transvestites. They have sexual paraphilias, and also, I think transgenderism and gender dysphoria, which it causes significant impairment in their social life. That's, I think, the first sign. And the second sign is that they have a hard time, because it's interfering with their socialization. They can't find a job, or they're having problems with their family members and their friends, or they have a hard time making friends or maintaining relationships due to their gender dysphoria, the transgenderism. Transgenderism being like they're sexually aroused by, not sexually aroused, but like rather they consider not exactly homosexual, but like they don't consider themselves to be the gender that they were born in. They consider themselves to be a different gender. That's all that is. Gender dysphoria is like when somebody gets, typically they're very depressed. Like that's how you can first tell. Like they're really, really depressed. They're anxious. A lot of them are suicidal, and if not treated, they end up killing themselves. Like a legitimate suicide within like the few years of them. No, I think within the year or 2 years of them being medically diagnosable with said condition. I think what they recommend is to have them undergo gender reassignment surgery, which is the most successful way to treat gender dysphoria. I think what the doctors didn't mention about this was that there's only very few successful cases of transgender surgery. Very few. not a lot of people are successful in their surgery to be the other gender. As in, they get the transgender surgery and they are capable of functioning and behaving and being relatively accepted within there's a group of people that accept them for that, or by large just the general population as the gender that they're presenting themselves as. And they physically look and behave exactly as the opposite gender. Is it always gonna work, or is it always successful? Absolutely not. Do they look the part? At least some of them do. But actually it doesn't... The only reason that they're doing this is because there have been cases of successful surgeries, and it reduces the risk of suicide. That's the only reason why it's considered a medical condition. I don't know. I don't think that... Oh, that's what that was. I was wondering what the hell they were talking about. I was like, Yeah, I think they just didn't want to admit what they were getting involved in. But anyway, this is 21 minutes now. I'm gonna stop the video. These are real illnesses. If you see somebody who's sick and who's suffering from these conditions, get them in treatment to see a doctor immediately. Tell them you have a problem. It's an illness. It's treatable. It's curable. Don't think your life is over and you have to live like this for the rest of your life.